Hello everyone, welcome. Today we will be discussing about alcohol and drug abuse, a very important topic. So we will be talking about the commonly abused drugs, the adolescents and alcohol drug abuse, addiction and dependence, what is it, effects of drug abuse and prevention and control. So all these things will be discussed in this present video. Now, talking about drug and alcohol abuse. Surveys and statistics show that the use of drugs and alcohols have been on rise, especially among the youth. This is real cause of a concern as it could result in many harmful effects. So, the youths are there's high probability that the youth starts taking drugs at a very early stage. Proper education and guidance would enable the youth to safeguard themselves against this dangerous behavioral pattern, because this is a behavioral pattern. You just go ahead, you take a drug, and then you're getting addicted to the drug. It's a behavioral pattern. Once you're educated on this matter, stating that instead of saying, no, don't do this, if you're educated, well, this is a drug and this is what it would affect you on, then you would know, okay, fine, I'm getting addicted or I'm not getting addicted. What is that? In what dosage should I be taking? Because there are drugs which are actually medicines, and later there is an abuse and there is a addiction to the drug. So there are drugs which are opioids, cannabinoids, coca alkaloids. So there are various kinds of drugs which are there, and beautifully most of the drugs that we are obtaining are from the flowering plants, or they're obtained from the fungi. So now, coming into the opioids. So opioids, the very common thing, the heroin that we know about. So this opioids, they are drug which have a specific opioid. They will bind to a specific opioid receptor which is present in the central nervous system and the gastrointestinal tract. So this opioids, they are basically obtained from the latex of the poppy plant, which is Papaver somniferum. So they are obtained by acetylation of morphine. So if when they are from this latex only, I get a morphine, and they are being acetylation, a process is being done, acetylization. So once acetylization is done, we get the morphine. So now heroin, which is commonly known as smack, is chemically diacetyl morphine, which is white, colorless, better crystalline compound that we have. Generally, it's taken by snorting, that is, you kind of breathe in that, or it's taken by in the form of injection. Okay, heroin is a depressant and it slows down the body function. Next, coming to the next kind of drugs, which is cannabinoid. Cannabinoids is a very common kind of a drug that we have again from a plant product, which goes and which hits the brain. So cannabinoids are a group of chemicals which interact with the cannabinoid receptor, which is present in the brain. Natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa. The flower tops, leaves, and the resins of the cannabis plant are used in various combinations to produce marijuana, hashish, charas, ganja, all those things. So generally taken up, you inhale it, or there is an oral ingestion of it. These are known for their effects on cardiovascular system of the body. Our next one is the cocoa alkaloids. Cocoa alkaloids or cocaine is obtained from the cocoa plant, which is Erythroxylum coca, which is a native of South America. It interferes with the transport of neurotransmitter dopamine. Cocaine, commonly called coke or crack, is usually snorted. It has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. Excessive dosage of cocaine, it causes hallucination. Now, there are other well-known plants with hallucinogenic properties, like we have Atropa, belladonna, or datura plant that is there, which causes hallucination. These days, cannabinoids are also being abused by some sportsperson. Now, coming to drug use and abuse, as I was telling you, drugs, it can be very, very useful if taken in a very limited quantity. This itself, when taken in a very huge manner, it can cause drug abuse. Like I was just talking to you priorly about belladonna, atropa belladonna. Belladonna is a medicine which we have in homeopathy, which is very much used for various pain reliefs and all those. This causes hallucination if taken in a very huge quantity. Drugs like barbiturates, amphetamines, benzodiazepines, and other similar drugs that are normally used as medicines to help patients cope up with mental illness like depression and insomnia are often abused. So once you don't get a sleep, you take a sleeping pill. You keep on taking the sleeping pill. Okay. Morphine is an effective sedative and painkiller, very useful to administer to the patients who have undergone surgery. Several plants, fruits, and seeds have hallucinogenic properties, have been used for hundreds of years in folk medicines, religious ceremonies, and rituals all over the globe. When these are taken for a purpose other than medical use or in amounts or frequencies that impair one's physical and physiological and psychological functions, it constitutes the drug abuse. Now, coming to smoking. So, if I talk about smoking, tobacco. If I talk about tobacco, smoking, it is a way of taking hard drugs. So tobacco, it's used by human beings for more than 400 years. It is being smoked, chewed, or used as snuff. Tobacco contains large number of chemical substances, which includes nicotine and which is an alkaloid. Now, nicotine, what it does, it stimulates the adrenal gland to release adrenaline and noradrenaline into the blood circulation, both of you, which it raises the blood pressure and increases heart rate. You might feel good, but again, there's an adverse effect. The various harms that is caused by smoking, we have. Smoking is associated with increased incidence of cancers in lung, urinary bladder, throat, bronchitis, emphysema, coronary heart diseases, gastric ulcers. There's so many cancers or diseases that you can get if you're smoking. Tobacco chewing is associated with increased risk of cancer of oral cavity. Smoking increases carbon monoxide content in the blood and reduces the concentration of heme-bound oxygen. So oxygen, blood's work is to carry oxygen. So if the heme-bound oxygen is reduced, the concentration is reduced, you get less of oxygen traveling throughout your body. This causes oxygen deficiency in the body. Usually what happens, the thing is, when you buy a packet of cigarettes, you will have a warning over there that cigarette smoking is injurious to health. But it so happens that we overlook it. So you cannot miss the warning that's present. So it carries a warning. Now, yet, even after that, what happens? Smoking is prevalent in society, both among young and old. Knowing the dangers of smoking and chewing tobacco and its addictive nature, the youth and old need to avoid these habits. They need to avoid, but where are they avoiding? Any addicts requires counseling and medical help to get rid of the habits. Next, coming to drug and alcohol use in adolescence. All of us, we are adolescents. The target audience is adolescents, hence we have to talk about the drug abuse in the adolescence. Because if we stop it at a very right stage, then the abuse would not happen. Adolescence means it's a period and a process during which the child becomes mature in terms of his or her attitudes, beliefs, or effective participation in the society. The period is 12 to 18 years of age, and the process of becoming from a child to adult. So it is the adolescence is a bridge which is linking the childhood and adolescence. Adolescence is accompanied by several biological and behavioral changes. Adolescence thus is very vulnerable phase of mental and psychological development of an individual. So you have various changes. People talk in a various ways. You would feel some different. You would feel differently. So all those things. Now, what are the causes of alcohol and drug abuse? Maybe it's curiosity, a natural curiosity which motivates him or her to experiment. Let me try. Let me try. How do I smoke? If at your home, say a father or your parents is a smoker. Now, as a child, you would feel, okay, let me take a fag and see how does it feel. Why is my father smoking so much? Why does he like smoking so much? There should be something very, very good in this. Hence, it's out of curiosity. Need for adventure and excitement. Some form of excitement everyone is doing. Chalo, let me also go ahead. Okay, an adventure. Let me take this as an adventure and see how it feels like. Experimentation. So I'm trying to experiment. Okay, if this, no, not this. Okay, so I'm just, as a matter of experiment, I'll do it once and then after that I'll not do it. Let me give it a try, an experiment. Stress from pressures to excel in academics or examination. A complete stress that you have from people that you need to excel, you need to do this, you need to do that, can bring you into an alcohol or drug abuse. The perception among youth that it is cool or progressive to smoke. Achha, having a fag. They don't call it a smoke, but a fag. Okay. So it's very cool to take an alcohol. Maybe you are an odd one out if in a group of people you are not going to consume alcohol. Televisions, movies, newspapers, internets, they help in promoting this perception. You see in movies, you go ahead and in internet, you find out in today's day in various social networking sites, you find out how well they go ahead and do the mixing of alcohols, will prompt you all the more in the beauty of it and the color of it, so to consume it. Unstable or unsupported family structures and peer pressures. Friends are telling you, come on, let us have. And an unsupportive and unstable family structure, if they have. It's no one to talk to or something. So that also can cause you to take alcohols or drug abuse. This is complicated further by the effects that might be perceived as benefits of alcohol or drug use. Thus, the first use of alcohol may be out of curiosity or experimentation, but later the child starts using this to escape or facing problems. Now, there are various 5 stages in which a person start getting addicted to a drug. The child, as I told you, it starts with experimentation. So because of the perceived benefits, okay, if I take this alcohol, maybe I'll have a good sleep, or maybe I'll get stress free. With all these perceptions, they start taking it. Okay, so now what happens? There's addiction. There's a Physiological attachment to the certain effects, such as euphoria, feeling of goodness, and temporary feeling of well-being, which is associated with drug and alcohol. I start. Experimented, it felt good. I started taking it. Then increased tolerance. I'm taking this drug number of times. So, it drives people to take them even when these are not needed. And then what happened? Body becomes self-destructive. So once the body becomes self-destructive, now I need more dosage of it. The tolerance level of the receptors present in the body increases, and consequently, what happens? I feel with maybe this amount, nothing is happening, so I need to take more, right? So receptor respond only to higher doses of the drug or alcohol. It leads to a greater intake. Once your level of taking the drug is over the limit, you start having an adverse effects. So till now it was okay, good. Once in a blue moon was okay. But now it started having an adverse effect. It should be clearly borne in the mind that the use of drugs, even once, can be a forerunner to addiction. You might get addicted to it. It's a very warning sign. This addictive potential of the drugs and alcohol pull the user into a vicious circle leading to a regular use, which I call it as abuse. So when you are in regular use of the drug, it is an abuse. So he or she may not be able to get out. Now, in absence of any guidance or counseling, the person is addicted and becomes dependent on the. Now, I told you they become dependent. So now the fourth position is dependence, where they're so dependent on the drug, they start having an withdrawal syndrome. So, withdrawal syndrome is what? If you take the drug away from the person, they start having some characteristic symptoms. If you provide them the drug, they will be all right again. So they might have characteristics like anxiety, shakiness, nausea, sweating, all these things might be happening. And sometimes the symptoms can be even life threatening. It might require medical supervision. People would have to be sent to rehabilitation center. And this dependence, it leads the patient to ignore all the social norms in order to get sufficient funds to satiate his or her needs. So, will not care about anything, starts taking loans, start doing anything on this earth to get the drug. This results in many social adjustment problems. So there is a constant craving of the alcohol and severe alcohol related complications. So this is when the person is addicted to the drug. Now, what are the effects of drug or alcohol abuse? Having a drug or alcohol abuse, reckless behavior, vandalism, violence is there. You become very, very violent. Coma and death due to respiratory failure, heart failure, or cerebral hemorrhage can occur. Drugs mixed with alcohol, it might cause death. Damage of nervous system, liver cirrhosis can happen. Mental and social distress to the family and friends. Social problems like stealing, spread of infectious disease like AIDS, hepatitis, because you're going on taking drugs. Use of drugs and alcohols by pregnant women can affect the fetus. Loss of sexual drive and necrospermia might happen. Misuse of drugs by athletes to increase their speed and strength. So what happens? They take up narcotic analgesics, anabolic steroids, diuretics, and certain hormones to increase muscle strength and bulk and to promote aggressiveness. A warning sign that you are being alcohol abuse or you are drug or alcohol abuse. If you note this in your body, you can understand here there is an abuse that is happening. Drop in academic performance and absence from school. Drop in academic performance due to drug abuse is one thing. It's not because you're not studying. So, if you're not studying, there is a drop in academic performance. Again, if you are a drug or alcohol abuse, then again there is a drop in the academic performance. Lack of interest in the personal hygiene. You don't care where you're sitting, you don't care what is in and around you. That means there is a drug or alcohol abuse. Withdrawal and isolation. You try to move away from people, you don't like surroundings, you don't like gatherings. Depression, fatigue, aggressive and rebellious behavior. You're completely depressed, nobody cares about you. You feel very tired throughout the day. You're very, very violent, rebellious behavior is there. So again, drug or alcohol abuse is there. Change in the sleeping and eating habits. Fluctuation in weight and appetite. Loss of interest in the hobbies. There's no hobby. Deteriorating relationship with family and friends. Hence, that is why you are quite lonely. The side effects of anabolic steroids. So, one is it damages the central nervous system and the liver, that is, cirrhosis might occur. The use of drugs and alcohol during pregnancy, it can affect fetus, as I told you. Now, there are few effects that we say in the males. In the males, you can have acne, increased aggressiveness, mood swings and depressions might occur. There's a reduced testicles, decreased sperm productions, kidney and liver dysfunction can happen, breast enlargement can happen, premature baldness, enlargement of prostate glands. All these are the effects of taking steroids. In females, what would happen? You might be masculinization, like male like a body, you would have a muscular body. Increased aggressiveness, mood swings and depressions, excessive hair on face and body, abnormal menstrual cycle, deepening of voice, enlargement of clitoris. So, abnormal clitoris is very, very small, whereas there's an enlarged clitoris that might be there. There is a severe facial and body acne, premature closure of the growth centers of long bones resulting in stunt growth. All these are the side effects of anabolic steroid use. So there are anabolic steroid use that we keep on saying that there will be no growth. Next, it is very important that we prevent and control. So one option is avoid undue peer pressure. So do not pressurize people to drink or smoke. Okay, it's not at all cool about that. Educating and counseling. Please speak out what you feel. Help from parents and peers. It's very important that parents, the peers, your friends speak to you clearly about all those things. Looking for danger signs. So we have talked to you about the danger signs. You need to see whether there are the danger signs or not. Seeking professional mental health. So you can always go ahead and seek some mental or professional help. Go ahead in counseling. So psychologists and psychiatrists can help you. De-addiction and rehabilitation programs are there which can help you for this. So hence we can say no to the drugs and thank you.